Hello, I'm Dr. Helen PENSANTI, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're diving deep into a condition that affects millions of people around the world. It's called chronic kidney disease, or for short, CKD. Now, you may not feel it coming, but CKD is often silent in its early stages, gradually damaging the kidneys over time. From common causes like high blood pressure and diabetes, we now are going to groundbreaking treatments like exosomes, stem cells. And this episode is going to be about understanding the full picture of kidney health. Today, joining me is Dr. Bryn Henderson, a pioneer in regenerative medicine and a leading voice in innovative therapies. We'll explore what happens when the kidneys begin to fail, the hidden risk factors, and most importantly, what we can do about it. So whether you're a patient, a caregiver, or someone who just wants to understand your health, this episode is for you. So what is it?
Well, thank you. I've got quite a background in this. I was medical director of a dialysis unit for a couple of years, and I've helped many patients avoid dialysis. And so I think what we should realize is that this is a long-term condition where the kidneys lose their ability to filter waste and excess fluid in the body so that it builds up. Over time, this can lead to dangerous levels of waste in our bodies and need more water than you're used to drinking. CKD does not happen overnight. It progresses in 5 stages from mild to severe, and it's based on a test called the GFR for globular filtration rate, which measures how well the kidneys are working. Stage 5 means kidney failure and requiring either dialysis or a transplant to stay alive. It ends a family. What's really alarming is that CKD is often preventable and often shows no symptoms until it's already advanced. So people can be sick and not even know it. That's why awareness and this program is probably so important today.
Well, one of the things that I do for my patients is I tell them the number of the GFR. So I tell them, let's say they're at 100, and I go, no problem, you're good. Well, what if they're at 60? That's the threshold of, oops, you better get to a renal specialist fast.
Yeah, below 60 is not normal. So the most common causes are the common ailments, diabetes and hypertension. And believe it or not, gout comes pretty close.
Really?
And medications are probably third. Medications have a major disruption on kidneys because that's the filter. So it changes the way the kidneys function, and it doesn't allow them to grow more small blood vessels. So they're less able to filter the blood. There's other risk factors, obesity, heart disease, even smoking and long-term use of meds like NSAIDs cause problems. CKD can also result from autoimmune disorders. Now, there's only 600 to 900 of those, so it's not like you can figure it out fast. But autoimmune disorders like lupus and inherited conditions like polycystic kidney disease or even birth defects can affect kidney development and function. Sometimes poor nutrition and infections during pregnancy have raised much higher risks later on in life.
Why are the kidneys so important to the rest of the body? You've mentioned it's the filter.
Oh, kidneys play a huge role. It removes the toxins, regulates the water, creates a balance of the salt, and remember, it makes hormones, one of which is erythropoietin, which helps make red blood cells. It's also excellent at filtering vitamins. And when kidneys fail, remember, that stuff builds up with the waste in your body. It's swelling and fatigue. Fatigue is probably the most common early symptom. I think the brittle bones and things that anemias have is other illnesses caused by kidney dysfunction.
And that's what I was going to ask you. It was about the anemia. You mentioned erythropoietin, and that tells the bone marrow to make red blood cells. So if that's failing, you're going to be anemic.
Absolutely.
In more ways than one.
No question about it.
So let's say a person presents with anemia, but their GFR is over 60.
Well, then you have to work it out.
You have to,
You have to find out the cause of the anemia then. But the CKD is detected pretty easily and pretty early if we have that index of suspicion. In fact, I'd take a side note here and suggest that website, kidney.org, is fantastic. It's one of the best websites. Physicians, patients, researchers, all of us use that website because early detection is crucial to save lives here. The blood test, the GFR, is in the majority of comprehensive metabolic panels in the world. This is what tells us if the kidneys are filtering well. And if it's below 60, we need to get moving. The urine test, by the way, the easy dipstick urine in your office can easily determine if you have extra protein, if you're lacking fluids, i.e. dehydration, or if you have a pH problem, a balance of acids and bases in your urine.
What is the protein level in the urine that a doctor should be alerted to?
What you want to do is do it in a ratio. The protein level, if you're spilling protein, you're in trouble. That means the holes in the kidney are bigger and open more than they should be.
You know, I'm a big proponent of annual physical exams, and, some of these insurance companies block it and stuff like that, but we can catch so many things.
Yeah. We do an advanced clinical exam in our office. Everything's digital, and we do from head to toe. It's covered by insurance, and we have an average of about 3 illnesses that we detect that the patient doesn't even know they had.
Okay, so let's talk about common symptoms that people should look out for.
Well, early CKD often has no symptoms. That's why it's called silent, but it progresses. Usually, like I said, with the fatigue, people feel tired. And then swelling. Swelling of the legs or face have to have a reason why. And that's usually because they have trouble concentrating the urine. They lose their appetite. And, another good clue is the foamy urine.
So if someone sees bubbles in the toilet.
You bet. That they can also have cramps or itching because kidney disease causes itching.
Let's talk about treatment then. What could be done for someone with CKD or chronic kidney disease?
Well, treatment depends on the stage, but where to begin, I can tell you, is very easy. Find out from the patient what kind of history they have. So the first thing to do is to find out their urinary habits, and that is history. So that involves blood pressure. Why? The kidneys are controlling the blood pressure, is a better way to say it. Manage sugar for the diabetics as well. So dietary changes help. If you lower salt and protein intake, you help reduce the work of the kidney.
Well, wait a minute. Is that why the kidney diet is low in protein?
Absolutely is. People are advised to stop smoking and exercise all the time for all kinds of reasons. Nephrotoxic medications should be avoided. So nephro means kidney, and that is a big chunk. Antibiotics are the most common, some non-steroidals, and those areas, non-steroidals, are commonly given for something as simple as arthritis, and they have an impact on that kidney.
Let's get a list of the top, say, 10 nephrotoxic medicines, so anyone who's listening to this show can say, whoa, I take that. Let me see if I can find an alternative and not put myself in danger's path.
Okay, so the nephrotoxic, meaning cause kidney damage, are antibiotic aminoglycosides, gentamicin and tobramycin. And the antifungals, think all the fungal toenails and people are taking all the antifungal. And some cancer medications like cisplatin. There are other drugs that are nephrotoxic that are common. That's the NSAIDs we talked about, non-steroidal anti-inflammatory drugs.
All right. So the average person listening doesn't know what aminoglycoside antibiotic is. So
okay, that's fair.
Yeah.
And so if you itemize some of them, gentamicin, tobramycin, but you also have neomycin and streptomycin.
Now, neomycin, they're handing that out like candy.
Well,
isn't that the topical too?
Yeah.
Oh boy, oh boy, oh boy.
So, and then the antifungals, which we can get into, the terracin B and all those. But the cancer medicines, remember how often people take those?
Yeah.
Cisplatin is chemo, and chemos work by killing the cells.
All right. You mentioned NSAIDs like ibuprofen. What's another one?
Well, the common one is Advil, Aleve,
Okay.
ibuprofen,
All right.
Motrin.
And then we have the ACE inhibitors that you mentioned that are nephrotoxic.
Those are blood pressure pills like lisinopril, and they're particularly tough for patients because they take them every day for their blood pressure.
And I have 1 million people on PPIs or proton pump inhibitors. Oh my gosh, almost everybody is on omeprazole.
Yeah.
Oh my gosh. And that is damaging their kidneys?
Yeah.
I'm taking them off.
Depends upon how much they take and over what period
They
of time.
take it every day, and you're not supposed to. And they come in and say, I want to refill. I'm serious.
Well, the key to this is, and I think my compliment back to kidney.org is very germane here. What these guys do is help us by staging it. And stages are essential to treating it correctly. But if untreated, CKD silently progresses. People get tired and fatigued and swollen. They get short of breath. They even have trouble concentrating. Like I said, we do this advanced clinical exam and we pick it up sometimes in their brain map. And of course, the bones being weak is a type of sarcopenia. And that means you have to get to the kinesiologist or physical therapist and start an exercise program gradually that starts to cause the bones to rebuild. Eventually, the kidneys start to fail. The good news is that with proper care, especially the earlier we detect it, the better, we can slow and even stop its progression.
All right. Can chronic kidney disease be reversed, or is it permanent once you get to, say, stage 3? There's no going back. So like crossing the Rubicon.
Good question, and that used to be true, but now at 3 and above, you can reverse pretty easily with giving patients new cells. The regenerative therapies work. If you get to a stage 4, then the 4 is actually divisible if you go to kidney.org into different A and B, and you can get into all that. But again, I agree that it's reversible, but you have to be very, very strict. And most of the time, remember, it's silent. You don't even know you have it. So you can slow the disease, you can prevent the complications. Yeah, I don't think most people in the audience would realize that if you're getting dialysis 3 times a week and going to the dialysis unit and you're sitting there for 6 at least to 7 hours, and then you're going home. But remember, you've been hooked to that line most of the day. And then you get home and you're exhausted. The next day, you're still tired. And guess what happens the third day? Oh, it's back to the dialysis unit. So Monday, Wednesday, Friday, you're screwed. You're already tired, and you're always tired on Tuesday, and you're always tired on Thursday, and you're always tired on Saturday. That leaves one day, Sunday. God's day is left for us to feel, quote, normal. It is horrible for the families as well as the patients.
All right. So we've been talking about regenerative treatments like stem cell therapy, peptides, exosomes. Anything work with chronic kidney disease?
Sure. Regenerative medicine is an exciting frontier because it makes new cells. These new cells, depending upon the origin of the stem cells you're given, repair tissues. It makes new cells. So if there's damaged areas, these substances are released to stop further damage, reduce the current inflammation, and block the harmful scarring. That promotes the healing of the kidney cells, and they reduce the damaged cells. So it does it directly by improving the environment in that kidney. These cells can be taken from many sources. There are even countries that are making organoids, and that is a stand-alone independent kidney, and organoids are used in many nations today, looking at a means to decrease the outrageous cost of kidney transplants and dialysis. They're mini kidneys, and they're increasingly used in research. Well, now there's patients that are getting. It's pretty exciting because we can get pluripotential stem cells and grow them. I got certified in that. Went down to San Diego about, I think 12 years ago and got certified in the pluripotential stem cells. We're just waiting for the regulators to give us enough slack so we can use it more and help more of the patients. It's very exciting.
All right, so let's talk about an actual patient that you had.
Okay. There was a 35-year-old male. He had a stage 3B CKD, and it was caused by lupus. That's an autoimmune disorder, and it attacks the kidneys. He'd had the disease for 8 years and was suffering from joint pain, muscle pain. Of course, he was anemic, and he had all kinds of nerve issues. Traditional medications, including the strong immunosuppressants like cyclophosphamide and cyclosporin, were not helping enough. So we tried some stems, and they were very successful. Exosomes are given with the peptides, and they instill in our bodies an enhancement to your existing stem cells. So what that did is extremely good result and improved his kidney function. Creatinine, urea, all those dropped. The GFR increased. In other words, his filter got more active. And most importantly, it impacted his symptoms. His joint pain decreased. He was able to move and sleep more comfortably. 7 months later, his kidney function had improved even more. His body had avoided dialysis. His lupus antibodies became negative, suggesting the disease was calming down. He had no longer a need for as much medication. As a side effect, his anemia improved, which meant he had less reliance on supportive treatments.
This is so incredible. I just love this, to think that a person could be having chronic kidney disease and you can reverse the numbers up to a normal range.
Now, we've done it if we catch it soon enough. A 3 is easy to catch. When you get into 4s, we've had 2 that I know of where we've avoided dialysis completely.
Amazing. All right, so now let's talk about traditional Chinese medicine. How does that fit in with chronic kidney disease?
Well, traditional Chinese medicine has been around a lot longer than we have. They have been very effective. See, traditional Chinese medicine, it's abbreviated TCM, impacts CKD, chronic kidney disease, because it restores energy balance. That's the kidney and the bladder meridians. And the acupuncture and moxibustion are used to restore that balance as well, relieve the symptoms, and support kidney function. Common acupoints are believed to enhance kidney energy. And the clinical studies show that acupuncture helps reduce protein in your urine, improve fatigue, and relieve itching, especially those on dialysis. It's not a cure. It is a helpful companion.
What about children and young adults? How do they differ from the older patients that are just worn out from age?
Well, children and young adults with CKD are different. Kids with CKD often have congenital kidney problems. That means genetic. These have been inherited. When they move into adulthood, they need close monitoring because they're more vulnerable to complications. We recommend more frequent lab testing and include families and the caregivers in their care plan. These young people need extra support, both medical and emotional, to transition safely and avoid worsening of their condition.
All right, before we end, what message would you like to share with our listeners?
Well, since we're so focused on CKD and we know it's manageable, we like to use a mnemonic. It's called Kidney Care. It's a powerful way to protect your kidney in a step-by-step manner.
All right, what does K stand for?
Keep the blood pressure controlled.
I.
Intake of salt and protein should be limited.
D.
Don't skip the medicines.
N.
No smoking or booze.
E.
Evaluate labs regular. GFR, creatinine, and urine especially.
Y.
You need diabetic control.
C.
Consult a nephrologist.
A.
Avoid a nephrotoxic drug, any of them. You've been given a long list here.
Yeah. R.
Review your diet with a renal dietitian or specialist in kidneys.
E.
Exercise regularly. Help with blood pressure, weight, and energy.
Well, what we learned today is powerful. Chronic kidney disease doesn't have to be a one-way street to dialysis or transplant. With early detection healthy lifestyle choices, new treatments, and traditional medicine support, there is hope. And I want to encourage everyone, when you go to the doctor and they say, I want a urinalysis, don't say, I can't go right now. That's what they usually say.
Yeah.
I just went, doctor. I can't. I do. I hand them a bottle of water and I say, well, we'll wait. Drink this because I'm not going to let you now for sure. After listening to Dr. Henderson, no one's getting out of my office without a UA because I'm going to look for that proteinuria.
Good.
I'm going to look for these things in your blood. Well, I always do with the GFR, but now we've learned more. I've learned more. So listen to your body, ask questions, and get tested. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen PENSANTI. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.